Dr. Jane Harrison. I'm a small animal practitioner and owner of Middlesex Animal Hospital here in Reading, Massachusetts. I've been a veterinarian for over 25 years now. I'm a 1987 graduate of the University of Missouri College of Veterinary Medicine. Even though I went to school in Missouri, I am a resident of Wakefield. I grew up along with my husband in Stoneham, next town over. So we were very happy to come back here after being out in the Midwest for so many years. We're starting now our 14th year. There really wasn't anything here except for the bathrooms, and we just built around this. I already knew what we wanted for minimum 2 exam rooms. They had to be a certain size, but we did fit a full-service surgical room. We have x-rays and a processor. We do dentals here too, so we are able to set up our dental equipment. We have a fairly good, well-stocked pharmacy. A lot of these, anything we don't have here, I can prescribe to online pharmacies or even next door at our pharmacy. So it's full service. Our niche here is really to be a community-oriented hospital, especially for moms and their kids to come in. We try to make it easy for them to come for the front door with carriages and animals, and it's worked out very well for us. My client base, I mean, we basically see dogs and cats, a little bit more cats than dogs, which is typical for this area. And we do see about 10% of our clients are rabbits. We have Sloppy, our house rabbit. She has been with us 8 years now, I believe. We adopted her as a baby. She really just fit into my hand. She was so small. She's been our goodwill ambassador here for these 8 years, and she's grown up here, so she has no fear of dogs, people, kids. Coming into spring now, and of course that's our big tick season. And unfortunately, we do have a lot of ticks now. I mean, we have deer infiltrated this area for the last few years, and along with that come the deer ticks. And we do also have dog ticks and wood ticks. They're less likely to carry the diseases we see, but we just have to be mindful because these things are easily prevented with monthly prevention. Technically in this area, May to October is our heartworm season, because there has to be a certain ambient environmental temperature in order for the larvae to be effective in the mosquitoes. So it's not going to be year-round, but again, people don't remember to start in the spring, and that's when they're going to be most likely infected. So you can technically stop in the winter time if you need to, and we test every year just to make sure we pick it up, because if they contract it, it may be a couple of years before you even notice the symptoms. We're a good resource for if you're particularly picking out a dog, because there's so many different breeds and different personalities that if they're considering a puppy in particular, give us a call, because we can tell you, dogs have different personalities. We want to make sure those pets are going to be something that suits your lifestyle. So if you want a couch potato, you want a dog just to sit in your lap all day and you don't see yourself going out for walks, you might want to get a King Charles Cavalier dog instead of a Jack Russell, because they're going to have different problems and different behaviors and resulting in problems if you don't give them exercise. So use us to help you pick out a dog that's going to work for your lifestyle. So these are all considerations when you're getting a new dog, because it's a long commitment. So we want to make sure you get a good match.